Hi, Professor Michael Tirant.
Hi, Casey. How are you?
I'm good. How are you?
I'm very well, thank you. It's nice to be back.
Yes, me too. So today I got a special case. We're going to talk about the baby, just only 8 months. If you can have a little picture, and can you tell me a bit about the condition of the
Yes, this is a little baby with 8 months old with very severe eczema. The eczema is all over the body, including the face, worse on the face, obviously. And I really feel when I see a little baby with severe condition because I have child too, you know, you feel for them. They're little and they almost not able to say anything. They can't talk to you. They can't tell you how they feel. But when you look at them, you can understand their situation, that they're not comfortable.
But is that the type of the psoriasis?
No, this is not psoriasis. This is eczema, atopic eczema. Yes. His eczema started after infection, but we also believe that he had mild eczema after he has vaccination, but after the infection, it became very severe.
But how about, I mentioned that the baby, they got the breastfeeding from mother. Can you tell me what the reasons why they had the eczema?
Yeah, well, this is interesting because it's a breastfed baby. So with breastfeeding, we understand that the mother is very stressed. You know, the mother's got a lot of problems. So on top of that now, the mother has to feed this little baby. So because the mother is stressed, there's a lot of stress hormones in her system. And when she feeds the baby, the stress hormones is carried on to the baby. So it makes it very difficult for the baby. And the mother did mention that after she fed the baby was always worse and crying and itching and scratching. This is predominantly due to the mother. So in this case where mothers are feeding the baby, we have to treat the baby, but we have to spend more time treating the mother, helping the mother, look at the potential triggers that the mother is going through that can affect the baby.
But after that, if we cannot get the good results, shall we stop breastfeeding?
Well, ideally you have to, because if the baby is not being helped, then it's important. And if the mother cannot make any changes, then it's important that we stop breastfeeding and look at alternative ways.
It sounds like poor to the baby, but I think we have to, because if the mother, they suffer with the mental health, it's very important.
It's difficult. It's a difficult situation because I'm sure the mother wants to help, but she's got her own problems. And so it's difficult.
But before they bring the baby to you, did they tell you which treatment they use for the baby?
Yes, they went to a few doctors and the baby used topical steroids with some good results, but it kept coming back because there are triggers there, you see, that needs to be looked at.
And after that, how did you treat him?
Well, the baby was treated with, again, very mild moisturizing cleanser and also some cream, which we use. Again, we use a lot of herbal bioactives, natural products as much as possible.
Too young, isn't it? Just only 8 months.
And we also looked at the mother to try and help her. But it's very interesting that you say, should we get the mother to stop the breastfeeding, which we advised. We had to advise because in the initial stages, there were very limited improvement. So we recommended that the baby is not breastfed anymore.
Because from my experience, if the mother, they have the depressions, it takes a long time to improve. So that's why I think the best way they have to stop breastfeeding.
Yeah, absolutely, absolutely.
So can you tell me how long to get the results for the baby?
Well, the baby had very good results from about 3 to 4 weeks.
Quick.
And after about 2 months, the baby most of the skin was cleared up.
But how about the mother in this case?
The mother was not associated with the baby anymore because obviously not breastfed. But we did a lot to help the mother also with her stress. with the management of the stress, what she could do to help herself. We try to get her to do some exercise, to do activities maybe that would help her a little bit. Because it's very difficult when you have mental health, you know, like to try and be reasonable about what to do.
Yes.
It's difficult for her to reason what's going on, because sometimes their mind is so active and going to everywhere. So it's difficult for them to settle and relax. But it's important also, because the mother has to still care for the baby, that we do something to help the mother.
I see. You know, that's just like personal question. I got my friend, when she breastfeeding, she got the itchy on the hand. Mm-hmm. But after that, the baby got the eczema on whole of the face. Is that?
It's possible, because if the mother has eczema, because eczema is still a genetic condition, it doesn't matter. Even if you had one little dot, you still have eczema, it's still genetic. You can have one dot, but then when you pass it on to your child has got a flare-up all over the body. So once it's a genetic condition, it can be passed down.
Now I understand, because before I'm quite confused about this case. Yeah. Thank you for Professor Michael. I'm sorry, nice to meet you today.
It's been a pleasure. Yeah. Thank you.